On News and Views this morning. And as we continue with the show this morning, we welcome our listeners at One Nation 88.9 FM out of Polokwane, and also staying in the company of our Salam Media and our Alantar listeners both in Durban and Pietermaritzburg. Now, still to come on the show this morning is shortly we'll be joined by Dr. Mohamed Moti, who is a Johannesburg-based practitioner, also a volunteer at the MASA, which is the Muslim Association of South Africa, the Vaccination drive-thru site. We will be talking with Dr. Moti what this is all about. And also later on in the program, we'll be joined by the Regional Director of Africa Muslims Agency, Hafez Hussein Chunara, getting feedback out of Afghanistan. And also we'll be joined by a member, Behruz Hamid, who is a member of Africa Muslims Agency in Afghanistan. So we've got quite a bit to come on the show. But before that, it's time now to join Dr. Mohamed Moti, Johannesburg-based practitioner and also a volunteer at the Vaccination drive-thru site, the Muslim Association of South Africa. Dr. Mohamed Moti, Assalamu alaikum wa rahmatullahi wa barakatuh, Jummah Mubarak, and welcome to the program.
Wa alaikum salam, Jazakallah. Thanks so much for having me on the show.
Yes, wonderful that you are able to join us. Now, obviously, we've seen this vaccine drive, and we see many communities, we see many organizations obviously participating in the vaccine. Now, the vaccination drive-through at the Houghton Masjid, and that is what we are talking about today. And if you could just take us through, what is taking place, and also what gave rise to the idea of having this vaccination drive-through at Houghton.
So basically what we are doing at the Houghton Masjid on West Street is we have set up, as you mentioned, a vaccination site in partnership with the Department of Health. And what differentiates this site from the others is that it is a drive-through site. So basically people are able to drive to the masjid. They wait in their cars until it comes and their turn to be vaccinated. When they get to the front, they can jump out of their cars or stay in their cars, receive their vaccination, and drive out. So basically, it eliminates the risk of waiting in long queues that may not be adhering to social distancing. And so even though sometimes the queue might be a long wait, they have the luxury and comfort of waiting in their cars. Now, of course, everyone does not have to come in a car. We also do we have facilities for walking people who are walking past the masjid, who don't have access to a car. They can also come and get vaccinated. And basically, I think I can't speak for the Muslim Association of South Africa entirely, but what I gather from them is this all came about as an answer, the community's answer to assist with the national vaccination rollout. I know not too long ago, the numbers of people that were getting vaccinated were not as high as we had hoped. People were struggling to get their vaccinations. People were hesitant to get their vaccinations. There were long queues, long waiting times. And so this is the Muslim Association of South Africa's answer to assisting with this vaccination rollout so that more people can get access to vaccination and more people can ultimately be vaccinated in a more rapid period of time. And alhamdulillah, it has been working exceptionally well. Since our opening, just about 2.5 weeks ago, and yesterday we reached the 10,000 vaccination mark. And last week, Saturday, was our highest single number of doses done per day. And that was at about 1,100 doses were given at the Houghton Masjid. About 300 doses were given in El Dorado Park as a branch of the Muslim Association of South Africa's vaccination drive. So all in all, we gave 1,400 doses just last week, Saturday.
Dr. Moti, is this for people who have registered to be vaccinated or not?
So yes, ideally it is for people who have registered to be vaccinated. So if you have registered on the EVDS website, you are more than welcome to come through. If you are having difficulty registering, or if you don't know how to register, come through anyway. One of us will be able to assist you with that registration. And if not, our data capturers will be able to register you on the system once they are capturing your vaccine.
Right. And just looking at the logistics, and obviously this requires a logistical operation, and I'm sure, healthcare personnel and other volunteers, how is it, what is the process in terms of obviously getting these volunteers, number one, but also just making sure that all the logistics are in place?
So, Alhamdulillah, we have been very fortunate. We have a wonderful group of volunteers that are relatively regular. But you're right, it is a big challenge. And I think a lot of the sites, the other sites that come up, will also face the same challenge, where we need as many people to help us as possible. So we're very fortunate that during the week, we do have a group of paramedics that are there, and they pick up any slack should we not have enough people on the day. But say, for example, on the weekends when we may not have all the paramedics on site as we usually do, we do require the assistance of volunteers. So a lot of the time, say, for example, for this coming weekend on Saturday, by a Wednesday, I'll start making some phone calls to friends and colleagues to see who can help, and people who have expressed interest in volunteering, we try and get them organized onto a roster so that we know that we are covered for the day. And if any of our listeners are willing to volunteer, I must say we'd be so appreciative of their help, and there is something to do for everyone. So yes, we do need healthcare workers specifically to give the vaccination, but anyone else who can help us with data capturing, with writing out of cards, all of those things are needed. So from that point of view, we have been very fortunate in that the community has come together quite well, and the community has stepped up to assist us where they can. But it is something that does require some logistics. But we are in a very fortunate position where we do have a group of people that are there as often as they can be. And so they do tend to pick up the slack. Myself, for example, I'm there almost every day after work, but sometimes that's just for the tail end of the day. And there are people that are required earlier in the day. But alhamdulillah, so far we've been managing. Of course, it is something that we hope will continue, and we encourage all of our volunteers and anyone else who's willing to volunteer to please step up and join us, because of course, just how there is something called lockdown fatigue, I'm sure that volunteering fatigue can kick in at any time.
Yes, I've just got a question that's come through on my WhatsApp. A listener wanting to know, are there any costs associated with the vaccine? Are people paying for the vaccine?
No, not at all. Nothing. Of course, I mean, if you're driving, you have to pay for petrol to get there. But other than that, there are no costs whatsoever. So you come in, inshallah, I hope that Salam Media will be able to come and visit us at the site, and we can take them for a drive-thru, and maybe you can post it for your listeners and for your viewers so that they can see what exactly it entails. But basically, if you're familiar with the house in Masjid on West Street, you drive into the driveway, there's a tent there, your temperature will be taken, you'll be given a form to fill in while you are waiting in the queue. You continue to take a loop through the parking lot, and on the other side of the parking lot, there's a marquee. And then you basically drive into the marquee, park in a parking bay. There's about 4 or 5 parking bays that are vaccination bays, and you'll get vaccinated. You reverse out, drive around the corner to be observed for 10 or to 15 minutes to make sure you're okay, and then you drive out, and it's simple as that. So the only thing that's changing hands is for the people to fill in, and once they are vaccinated, they get their vaccination card. No money exchanges hands.
Well, I'm sure, Dr. Moti, we will be able to arrange the Salam Media team to basically come out there to do a live broadcast. I'm certain that can be arranged. And just how much longer is this initiative likely to continue?
I can't give you an exact time, but I do know that we are intending to continue up until beyond the point where the next group, the 18 to 35-year-old age group, are eligible for vaccination. So currently, if you're over the age of 35, you are able to receive the vaccination. Of course, if you are under the age of 35, but you have, if you're a teacher, if you're a healthcare worker, you can also, or other groups of individuals, you can also receive the vaccination. But we are hoping to stay open open until after the 18 to 35 age group has opened for their vaccinations, so that we can also be a part of rolling out as many vaccinations in that age group as possible. Thereafter, I'm not sure. I'm probably not the right person to speak to, and I think that will probably be a decision made further down the line.
Dr. Moti, Jazakallah so much for that and for your time with us this morning here on Salam Media. We wish you all the best. Allah accept, Allah reward your efforts and everybody else that is involved in this vaccination drive. And have yourself a wonderful Jummah, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. Thanks so much for having me on the show. And like I said, I hope to see Salam Media at our site very soon. And inshallah, if anyone has any interest in volunteering with us, please forward me their details and I'll be in touch with them.
Jazakallah for that, Dr. Moti. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Dr. Mohamed Moti, Johannesburg-based practitioner, also and a volunteer at the MASA, the Muslim Association of South Africa Vaccination Drive-thru site at the Houghton Masjid in West Street.